We have harvested Peroneus Longus tendon and we are folding it in unequal manner so as to make one of the limbs as a POL and another limb as a superficial MCL. The POL limb has to be about 9 to 10 centimeters and 6 centimeters more than that would be superficial MCL. We are fixing this end with the adjustable loop and making the sutures so as to close this and make it as a one of the ends for the femoral side so that this graft will not move in the folded position, and this will be fixed at the femoral end. Since this is adjustable loop, we can re-tighten this after we fix the tibial side graft. After we do this, we are creating the femoral tunnel from the medial epicondyle through percutaneous position. This is the scope kept in the ACL tunnel so that we are sure that we are not doing any tunnel coalition with the ACL tunnel, because this procedure is always done with the ACL's reconstruction. ACL is done with the quadriceps tendon and MCL is done with the peroneus tendon. Now after we do the femoral tunnel, we are now doing the POL tunnel, that is 1 centimeter distal to the joint line. Checking in the C-arm, we are creating 6 mm tunnel, over drilling the guide wire, and 6 mm tunnel is created throughout the bone of the tibia. Slightly anterior to that would be superficial MCL tunnel, that is about 6 centimeter distal to the joint line. This would be again 6 mm. The broader end of the peroneus would be in the superficial MCL, and the distal part would be the distal part of the peroneus, that is the Peroneus Longus tendinous portion would be in the POL. After we complete the tunnel, we are creating the subcutaneous plane so that we put the passing stitches from the superficial MCL to the medial epicondyle, and again another one from the POL to the medial epicondyle. We will start the graft passage from the femoral side, and we check the flipping of the button and then take the graft to about 2 centimeters in the femoral tunnel. Once that is done, we pass the superficial MCL and POL through the subcutaneous planes, and then we fix the superficial MCL and POL first, POL in 30-degree flexion and superficial MCL in extension. After that is done, we again can tighten this from the adjustable loop in the femoral side. So this is the advantage of this technique, where this graft, single graft, will give two-tailed MCL and stable enough in both flexion and extension, and then can be tightened again after the fixation. I hope this is useful to you. Thank you.